Greetings and welcome to another lecture in Introductory Psychology. This one involves the dissociative disorders, which are really rather fascinating. One of the ways in which they're fascinating is they appear to be one of the few disorders that are completely and totally psychological. There doesn't appear to be anything physiological going on here, which, as I said, is unusual. A lot of disorders have both, but this one seems to be purely psychological. Now, they're called dissociative disorders because in these disorders, the mind dissociates. Dissociate is the opposite of associate. When you associate, you bring together. When you dissociate, you split apart. And in fact, this is the actual definition, the actual disorder described by saying someone has a split personality. A lot of times when people say split personality, they mean schizophrenia. Schizophrenia is not a dissociative disorder. What goes on in schizophrenia, where the split is there, is between the person and reality. This split here is more into complete, distinct separateness. Now, there's a couple of ways that this can be done. There's a couple of dissociative disorders. The first one is called dissociative amnesia. Now, since it's an amnesia, it does indeed involve loss of memory, but the loss of memory here is not caused by any kind of physiological event, like most amnesia, caused by a head injury, stroke, that sort of thing. This amnesia is, at least theoretically, caused by some sort of traumatic psychological event. I sometimes call this soap opera amnesia because pretty much the only place where you really see this is in soap operas. The person hears some horrible news and all of a sudden they simply cannot remember anything. They can't remember who they are, where they are, who these other people are. They have lost their memory because of that horrible traumatic event. Psychologically traumatic, but traumatic nonetheless. Now, as I said, this isn't seen very often, and it's generally seen in fiction a lot more than in reality. That's actually true of all of these disorders, is they are probably quite rare. The second one is similar to dissociative amnesia. It's called dissociative fugue. Yes, F-U-G-U-E is pronounced fugue. That's why people hate English, although that's not an English word. But dissociative fugue is when a person, because of some sort of horrible, traumatic, psychological reason, loses their memory. But instead of wandering around going, who am I, where am I, and who are you, this person travels some distance and very often sets up a new life wherever it is that they land. They make up a new name, they may make up a history, they may, they're probably going to make new friends, get a new job, they may even get married, have children, all with no memory of their prior life. And then what can happen is at some point this fugue state can end, in which case the person will have no memory of what went on during the fugue stage, but will remember what went on before it. They won't remember the family and the children that they made during the fugue state, but they will remember the friends and family that they left. Now, the thing about these dissociative disorders is, in some cases, they're all very rare, but they also, like dissociative fugue, sound very convenient. Because I'll bet all of us, when we've been under a huge amount of stress or something bad happens to us, have said to ourselves on some conscious level, I'm just going to leave and quit my job and just ditch all this horrible stuff and, move to Tahiti and become a beachcomber and change my name so nobody can find me. And dissociative fugue is really close to that. Now, we can't tell whether or not people who have undergone dissociative fugue actually are faking it, which is a horrible way to put it, but that's what we're talking about here, or whether this is indeed something that does happen, partly because it happens so rarely that we can find people in this dissociative fugue that isn't caused by something like drug use or a head injury, that sort of thing. But the real dissociative disorder that has everybody talking, and the one that may be more common than those first two, is called dissociative identity disorder. This is the classic split personality. It used to be called multiple personality disorder until they decided to call it dissociative identity disorder to make it more clear what we're talking about here. What happens in dissociative identity disorder is that a person has two or more distinct separate personalities. Usually there is original personality, the one that's been there since birth. But then there may also be other personalities. There may be one, there may be a dozen, there may be hundreds. Now these alternate personalities all may know about each other and they all know about the original personality, but the original personality usually is completely clueless. They have no idea what's going on. All the original personality knows is that they keep having these blackouts. And when they wake up, it's hours or days or weeks later, and they have no memory of what happened in between. Well, that's because, according to theories here, what happened in between is the other personalities came in and took over. Now, the idea behind dissociative identity disorder, as I said, is that there are these other personalities. And there may indeed be some very distinguishing characteristics there. The alternate personalities, for instance, may be of different ages than the original. They may be of different sexes than the original personality. They may be of different racial background, racial makeup than the original personality. Sometimes the different personalities may show actually some physiological differences. There's been some evidence that different personalities may have different blood pressures, for instance. Or they may have different brainwave patterns. Although I have to admit that actors also can do this by taking on different characters. I have heard that people with multiple personalities, that different personalities may have different handedness, which I would find very interesting. I would wonder how much the person was ambidextrous to begin with. I've heard that people with alternate personalities, that the alternate personalities may have different visual acuity. One personality may be nearsighted, one may have normal vision, that sort of thing. Now we're getting into the realm of I'm not so sure about this. Because a lot of visual problems seem to be physiological. And I'm not sure, for instance, if you're nearsighted, that you could, quote unquote, fake being or suddenly become, fake or not, suddenly become farsighted or have normal vision. As someone who's very nearsighted, I just don't see how that's possible, that I could just all of a sudden with another personality see normally out of these bunged up eyes that I have. But apparently that is so. And the one that really gets to me, being female, is I have heard that different personalities can have different menstrual cycles. Which leads me to kind of go, okay. Now the idea here is that these different personalities come out when the original personality, for instance, may not want to deal with a situation. The whole basis of dissociative identity disorder is that at some time, probably very early in life, that child has undergone a really traumatic event. And we're not talking garden variety trauma. We're talking truly horrible physical or sexual or even psychological abuse here. Horrible, horrible stuff. Now, when something bad is happening to the child, of course, doesn't necessarily want to face it. And so what they may do is they may figure out a way to have most of their consciousness kind of go and hide under the bed, while only a bit of them is left behind to face the world, to face that abuse. And we know through hypnosis, for instance, under hypnosis, you can kind of dissociate a person to the point where you could tell this person that they will feel no pain and do dental surgery on them without painkillers or anesthesia. And by golly, when they come out of hypnosis, they claim to not feel that. Where are those memories? Well, they might be hidden away. They might be, the mind might have split into alternate tracks, and the track that experienced that extreme pain now is kind of put away, and therefore, since the rest of it doesn't know what happened, they don't feel it. So we do have some experimental evidence that this sort of thing may be possible, that this sort of hugely traumatic event may indeed cause people to have this sort of dissociation. And after all, if you think about it, all of us have different personalities depending on our environment. You probably act very differently when you're at home than you do when you're at work, than you do when you're with friends, than you do when you're with your grandparents, than you do when you're at church, if you go to church. I mean, those are all different personalities. It's just that in most of us, we understand that these are all just different facets of ourselves. But somehow in people with dissociative identity disorder, those different facets gain autonomy and become their own person. Now, this diagnosis, as common as it might seem to be, I mean, they're making movies and everything about it these days, is still very controversial. Because it's difficult to tell. Again, I hate to use the term real, but it's difficult to tell how much of this is a disorder and how much of it is created in one way or another. This disorder was pretty much unknown up until the mid-1950s, when, perhaps coincidentally, perhaps not, came the publication of a book called The Three Faces of Eve, about a woman with 3 distinct personalities. And then all of a sudden, doctors began finding patients with this dissociative disorder in their practices. Now, it might have been that indeed doctors now knew what to look for. Instead of classifying it as schizophrenia, they now classified it as dissociative identity disorder. But it could also be something else. What it could do. And then it really took off in the early 1970s with the publication of a book and later the making of a movie called Sybil, about a woman with a dozen different personalities, which, by the way, has been debunked. It was pretty much a fraud. Not that Sybil herself was sort of going along with the fraud, but what seems to be happening to her is that she so much wanted to get better because she knew that there was something weird going on, that she went along with whatever her therapist said. If her therapist said that she was feeling these things, then she said, yes, I am, because she wanted answers. She wanted to be able to say, this is what I have, because hopefully then it could be treated. And people might be even more likely to do that now. Because people still, when they go to a doctor, they want treatment. They want to know what's wrong with them. And most everybody has probably either heard of multiple personality or seen a movie or a TV show with someone who has it. And so when the doctor says, so do you ever feel that there might be someone else in your mind? Most of us have felt like that at one time or another. The person might say, yes. Do you ever feel that's a different personality? Well, yes. And then on some level of that patient's mind, they might be saying, yes, that's what I have. I know how this works. This is what I have. I've seen it. I saw me, myself, and Irene. I know how this works. And so without knowing it, they kind of go along and they know the whole personality's taking over and the change in between and the original doesn't know and that sort of stuff. This possibility is backed up a bit by the fact that there are some therapists that it seems like every one of their patients winds up having this disorder, having repressed memories that need to be recovered, or having different personalities, while other therapists never ever see it. And so this is not a sort of set in stone diagnosis. Psychologists are still arguing about this, the dissociative identity disorder for sure, but the other two as well. They're still arguing about how much of this is real, how much of it is manufactured deliberately or not. And it would be very useful to be able to figure out a way to test for sure that this exists. The problem is, since it's purely psychological, we can't look for physiological markers. And the physiological markers that we do have, for the most part, can be duplicated by skilled actors. So I don't have a really good answer for this for you, other than the dissociative disorders, while they get an awful lot of attention, and a lot of people might think that they are more or less without question things that exist and things that people are diagnosed with accurately. In psychology, we're not so sure.